Good evening. Thanks for joining us as the country heads towards a sixth wave of COVID. Confirmation tonight, the BC vaccine card will indeed be dropped on Friday. At the same time, BC is gearing up for a spring booster program targeting the elderly and most clinically vulnerable with a fourth dose. And the vaccine requirement for post-secondary students living on campus is also being lifted. We're learning that about half of British Columbians have had COVID. The provincial health officer says that's why it's a good time to remove even more restrictions. Here's CTV's Binder Sujin.
Some deep breaths, okay?
Roughly 60% of eligible British Columbians have their third dose. Soon, some will be asked if they'd like a fourth.
We are going to be offering a spring booster for elders and seniors.
Along with residents of care homes, those 70 plus, Indigenous people 55 and older, and the clinically extremely vulnerable will have the option of a second booster. They're most at risk and nearing the 6-month mark post-vaccination where protection wanes. As for everyone else,
at this point, we don't see it progressing beyond those most at risk.
And that will depend on how COVID-19 mutates. Public health believes our province has a high level of immunity.
So across the board, there's probably about 50% of people who have antibodies to the virus, which shows the nucleocapsid protein, which shows that they had exposure and infection.
That, says Dr. Bonnie Henry, means it's an appropriate time to relax some measures. The vaccine card was good at limiting the spread of COVID and encouraging people to get vaccinated, but it won't be a legal requirement as of Friday. Businesses can go back to less formal disease prevention plans, and students staying in post-secondary residences won't need to be immunized. Proof of vaccination will still be required for federally regulated travel, like on airplanes.
Prevention of infection is important. People who get infected with this virus can develop long symptoms, even if they don't have very severe illness.
The province will soon report on vaccination rates for health professionals to help people make informed decisions. With measures easing, hospitalizations are expected to rise.
We are likely to see a slight increase over time in the next month to 2 months, and then a gradual decreasing.
With almost all health orders ending, officials say people will have to make decisions about what they are comfortable with.
The weather does change every day. What we're seeing in terms of risk doesn't change every day. It's more like climate.
And the climate continues to be one of risk.
And Binder Sujin joins us live now from Victoria. And Binder, reporting is also changing this week. What can we expect?
Yeah, so right now the way that it happens is we get numbers Monday to Friday, except when there are holidays, and the province is actually moving to weekly reporting. We are told that we will get more detailed information. Now, when it comes to deaths, though, that process will be automated. So anyone who had COVID in the 30 days prior to their death will be counted as a death. Now, officials will then have to investigate and see if that should be the case. If not, they will remove them. That means the numbers are going to appear inflated at first, and the first weekly update comes tomorrow. Mijan?
All right, thank you, Binder.